So, the first thing, if you look on your little thing, that says make sure the table is locked. That is found right underneath here. You move it to lock it to your left. Unlock is to your right. Okay? Always make sure the table is locked. After that, you need to raise the table to the appropriate height for the patient to either lay prone or sit and go back on a supine position. So what you'll need to do is you'll have the patient stand next to it, and you want them to be about mid-thigh so that they can slide on easily either way. Line up crack to crack when they get on here, which means you need to be like this when they lay back, or you need to be like this when they get on, just because it's easier for the patient. Okay? That was Dr. Price, by the way. When you put the belts on, the belts will almost always be on. You want to lift this up. This piece slides right into, in between the white things. I don't know if that is all. And it just bar, and it slides in. You just pull it tight. This is for the thoracic. The pelvic belt will go over top of the thoracic belt. There shouldn't be too much a gap in between here, because what you really want to look for is in this table right here. You want middle of this belt to be about 2 inches above it. So it's going to be just like that. Okay? When the patient lays down, who wants to be my patient?
Shannon.
Okay, Shannon. Like, crack to crack. Thanks. Lay down. Oh, here, let me give you a pillow. Okay.
Okay, hold on for a second.
So when you're having the patient lay down, you know that you want 2 inches above this crack. Well, this crack represents, or the slit in the table represents the top of the iliac crest of the patient. So you want to find the top of the iliac crest needs to be right in the middle. So hers is perfect. So she's got about 2 inches until the middle of the belt. Just have patients move back and forth depending on where they need to be. You also, if a patient's laying in a supine position, you want to use the bolsters underneath of them. Their knees will be bent, laying straight under the knees, and kind of put them at an angle so that it's not uncomfortable for them. It's a little nicer if it's like that. Also, as soon as you start getting the patient in order, you want to move this up just so it's easier on your back. It's not a requirement. I forget it most of the time too, but it's smart. So the first thing that you'll do when you're hooking the patient up is you want to do the pelvic belt. You want it really pretty tight. So give it some gusto when you do this. If we have bigger patients, there's also this that connects with it. It will happen. So then you want to take the belt, which goes through the first 2 loops, and then back into the first one.
And hold that up so I can see that.
Okay.
Thank you.
Okay. And then you want to tighten it up. You want to tighten enough so that you start to see some ripples in there. To make sure that they're going to be in tight enough, okay? Also, the ring on the top here needs to be in the middle of the abdomen because the belt is going to come back up and loop up into there, okay? Now, you also want to make sure that when you're looking down here, you'll see that there's like this upside down triangle shaped piece of fabric. You want to make sure that that's right in the middle of them. You want to pull on this to make sure that it's all snug in there. Also, you want to make sure that it is grabbing on to that top of that iliac crest so that it's not going to move, and that's what's going to keep her staying right where she is. Then you want to do the chest or the thoracic belt. We have 2 options. one of the first things that you want to ask them when you're getting them all hooked up is you want to ask, do you get claustrophobic at all? Or if it's a female who looks like she might be large up top, she may be more comfortable with the posts that we have. Those are right under here. You just pull them straight out. And then there's pegs on the side here that you insert them into. Now depending on if the patient has monkey arms or not, it can go this way or that way, shorter or longer. Okay. If the patient has no problem with the chest wrap, then just use the chest wrap. The chest wrap needs to go on in a strong V. So you ask the patient to take a deep breath in, let it all out. At the bottom of the breath, securely strap them in. Then you want to come over to the unit. When you're using the rope release, you want to make sure that you hold the rope release down and pull at the same time, and then release, and it won't pull anymore. You have to make sure that you do that. It's not just a push and pull. You can let go at the same time. You have to hold it down, pull, and then let go when you want it to stop. You'll hook them right onto this. And then you want to hold onto this to make sure that it doesn't jerk them.
So that was the rope release button?
Yes.
Okay.
Okay. When a patient is in a supine position, there's a couple different things that I usually ask them if they want to do. I ask them if they want any kind of lumbar support. That's by this little wheel. You pull this handle out here. It's down like that. Pull it up, and then you just crank it. You ask them when it starts to feel good. This is for if patients have a sway back or really bad low back pain, anything like that. If they do, they probably are going to know their back, but anyways, okay. So you ask them, okay, when does that feel good? And they're going to tell you, okay, feels good right there. So you'll just keep it right there. Also underneath of here, there is there's some lines specifying what angle it's at on the decompression sheet that we have. That's where you'll write that information. You'll just look down under there, see what it's at, and then you can write it down. So then if you ever come and you don't remember or you'd never set them up before, you won't have to fight with it. You can just set them up and it'll be good. Okay? Does that feel okay? Okay, so this is for the, these two little latches are for the arm and the chest supports. Usually with patients that are on their backs, you want to primarily focus on the chest and head support just to give them a little bit of elevation so they aren't completely flat. How you do that? You pull the latch, and it's all air, so you just need to kind of lightly let it up. Don't just like pull it and then let them fly, okay? So just lightly let them up and then just let it go. Okay, ask them, how does that feel? Feel pretty good? No. There aren't any angles or anything on this one, so you can't specify what it is, but there is a place on the sheet that says, do they have chest support, leg support, arm support, chest wrap pegs, everything on there is specified, and I'll show you guys that if you haven't seen it yet. Also another thing to remember is that when you're doing the chest and the arm support, you have to, when you're going up, use put the chest support up first, arms follow. When you're going down, you have to do arms and chest, or else it won't move. Okay, and don't try to like break it. Oops. That's for supine. Okay, so once you have the patient all hooked up, ask them how they're feeling, if they're comfortable, if they're good. Perfect. If you look over here on the side here where the rope is, on the machine it has a couple different numbers on it. That's the level of degree that the rope is on. You want the rope to be at about a 15-degree angle, so you really need to get right down close to make sure that it is. She's right at about 15, so we're going to keep it there. If she wasn't, then you want to just move the table up or down in order to change that. So what you'll do to get a protocol started is you'll hit this gray file button that's right here. Can you guys all see it? Okay, hit the gray file button. You want to hit retrieve protocol. We're doing lumbar right now, so you'll hit lumbar. And then you'll pick the protocol that is specified by the doctor. The one that we've been using the most is Vax Long. And then we've also used CPM for older patients too. So you'll select the protocol by hitting the enter button, and then you always want to hit edit. And then what you're going to do is just hit the screen and then enter in the specified number that's given. A lot of the times we'll change the pounds for patients. You'll kind of learn as you go on if you need to change it. If bigger patients need more weight or smaller patients need less weight. Also, when patients are on their back, it seems like the weight is a little bit less than when patients are on their stomach, or that's what I've noticed so far. So once you have all of that information in, you will hit the start button. It'll say make sure the table is unlocked. You'll come right over here, unlock the table, and then you'll just tell the patient, okay, it's going to start to go up now. You'll start to feel a little bit of an increase, and then it's going to hold for about 30 seconds, and then you'll feel the maximum increase, and the table is going to start to move, and I'm going to wait until the table's got about a ½ inch to an inch gap, or an inch to an inch and a half gap if the patient is on their back, a ½ inch to an inch if the patient's on their stomach. So you'll just sit here, wait until it starts to get up to the very top. That's how the cycles work, is that's how you know the pounds are up there. Also, it goes up here and up and down just like that so that you understand where they're at in the cycle and what they're doing. So the table's already starting to move.
I just asked them, is that Shannon making that noise or something?
You would. Okay, so she's still got about 5 more pounds to go, and there's a pretty decent gap in there. It's a good inch, yeah, everyone? Okay. So what I do is I go in, put it back down to about 55, and hit enter. When you change the max pounds, change the minimum pounds too. Put it down 5. Try to keep the minimum and the maximum pounds 30 pounds between each. So if you do end up changing it, make sure the minimum changes also. So I usually stay through a couple cycles to make sure the patient's comfortable, that they're doing okay, that the table's moved properly, everything like that. Once that does happen, then I give the patient the panic call button. What this does is it will stop the table where it is. It won't shut it down. It'll just stop it where it is. It'll also do this really, really loud beeping noise. That way we can come in and we can be like, oh, it looks like at the 8th minute when she was at about 45 pounds, that really started to hurt her. So we know that. We can tell Dr. Price, hey, this was hurting her at this time. Also, make sure you turn the lights off for patients in here just so it's relaxing, kind of nice. So if you hit the panic button, this is what happens. You can look, everything on the screen stops, hit anywhere on the screen, and then it's going to actually start to decrease and it'll stop the whole process. If at any time you're at this screen or any other screen, hit the home button and it'll come back to a normal thing. So you won't have to worry about that. Okay, so again, with rope release, just make sure you hold it down, give it some slack, undo, back. That's the first thing I do when I take patients off. Also make sure that you lock the table. I usually take out the bolsters and put down anything that I've changed. So I'll lower this, move this back down, undo the chest strap. Once you have the patient all undone, everything on the bed is back to normal, you want them to turn onto their side first. Go ahead and lay on your side. Have them just kind of relax there for a minute, just kind of get their bearings back, whatever. At the same time, you can start to lower the bed. You want to lower the bed so that it's going to be enough that there's about 6 inches underneath their feet, so then they can just kind of slide off instead of having to like climb off. Okay. So once they're good, have them just sit up on the edge, kind of sit there for a minute, just kind of whatever. And then you're supposed to grab them like this and help them off. Okay? Thanks. Bye. That's it. Okay. Come over here and then just lay right down, face in there.
Isn't this prone, not supine?
Prone.
Yeah.
I call it supine.
Yeah.
Prone. Okay. Top of the hips, right about there. Perfect. Okay, prone works the same way as supine does. When you're hooking them up, there's no difference. Deep breath. Let it out. Okay, so with patients that are prone, there's a couple different things that you want to do. You want to make sure that they're actually pretty high up. You also want to, Karen, come over here and see it. What you want to do is pull this black thing. At the same time, you want to push underneath so this can pull right up. You'll ask the patient, grab on, hold on to that. Don't have to hold on tight, just kind of hold on. What it's going to do is help relieve the muscles in the back so that they kind of relax. Also, if the patient's really tall, squeeze these two together and it'll make it longer. Okay. Also, something that I usually do to help patients that are on their stomachs is I put the arms down just a little bit. It's usually a little more comfortable. Does that feel a little better? Yes. Okay. Also, sometimes they like when the headpiece is down a little bit more too. A lot of the time they don't, just because that's what's supporting their chest, but sometimes. Also, in the back here, there's a lever underneath here. You just need to push it, and it lifts up, helps relieve the hamstrings a little bit. Does that feel better up, or do you like it better down?
Up.
Right about there is good?
Yes.
Okay. Again, rope release. And on there. Okay. Prone differs in the fact that supine, you need to be about 15 degrees on with the rope. Prone, you want to make sure that you're at about 0 degrees. So once you have them all set up with that, you'll do the same thing. File, retrieve protocol, lumbar, say vax long, edit, keep the pounds where they are, and just hit start. Unlock the table, and then just watch and see how it goes.